So this is a short video just to explain the importance of lower limb strength and stability and balance. You know, why are we doing our November challenge and why are we looking into this month? So a lot of injuries are caused when we haven't got stability in our lower limbs. So ankle, knee and hip. So these three joints, well, and the joints in your foot, of course, have to work together to keep you stable. Now, very often we will, particularly women, we will tend to roll in and our knee tends to come in. And there's a couple of reasons for that. So our pelvis is wider than a male's pelvis. What happens is our femur, so our femur bones, our thigh bones, rather than pointing straight down, they're now coming at a slight angle. So we're at a bit of a disadvantage already being female with our knees coming in. So we have to work harder to recruit like the gluteal muscles. As soon as that knee comes in and as soon as we're in that position, we're sort of switching off our glutes. And our glutes are a massive hip and knee stabiliser. So these muscles here are really important. They work in this sort of diagonal chain. So with the quads and in particular the inner range quad muscle here, this works together to sort of stabilise our hip, our pelvis, our knee. So as we're walking and as I'm moving, what we want is to be coming in a forward direction rather than sort of collapsing in. So rather than sort of knee and ankle collapsing in. So when that happens, because a lot of strain through our ankle, through our knee, through our hip and even our back, and we'll even sort of rotate as well our pelvis. So being able to like fully weight bear on our leg and move, and the knee and hip and ankle are actually going in that forward motion is really crucial for injury prevention and not just lower limb injury prevention, but even what's going up on higher up in terms of our back and our shoulders, because it'll have an impact. If you're collapsing in there, you can see my pelvis rotates. So then that is going to twist the spine. That's going to have a knock-on effect all the way up. So that's why we're trying to strengthen and get a little bit more control through hip, knee and ankle to avoid injuries. So it's important that you're doing all the exercises well and using the instructions that I give. Use the foot pressure instructions. And if an exercise is too challenging, do an easier version. Make it easier by either not going as deep into the movement, doing it double leg rather than single leg. So all those things can really help. So it's better to do an easier exercise well rather than do a harder exercise and actually you're collapsing and not engaging the muscles you want to engage. So the other important thing is sometimes we struggle to engage our glutes when we've got tightness through our hip flexors. So if we sit a lot and we're at that angle with our hip flexors will get tight. When they get tight, they will then drag your pelvis forward. So you'll be in more of an anterior tilt with your pelvis because your hip flexors are tight. And then we can't access these muscles here. So we've got to be able to stand in neutral, have our pelvis in neutral, and also be able to extend our hip. So if you're lacking hip extension and you're tight through here, you're not going to be able to access this muscle. So that's why the mobility exercises are really important as well. So making sure that you're nice and loose through your hip flexors, also through your hamstrings, that you can actually access the muscles that we want for strengthening. So yeah, hopefully you found this video useful and it's made a bit more sense as to sort of why we're doing what we're doing.